Have you ever heard the voice or the phrase where they said knowledge is power? Well, the first time I heard that was by my dad. My dad always said knowledge is power and you have to study and study and study to have the power you need in your professional life to be the best and to do the best for your patients. So, like this program is educational, what about if I teach you how do you know you're gonna need a root canal or you are in the need of an urgent root canal? How do you diagnose yourself when you cannot find your dentist or your endodontist or whoever you wanted to call, or you don't have anybody to call to get a good diagnosis and to know if you're gonna need a root canal? Well, the root canal will be needed if you have maybe something like this, that the tooth is broken, and now when it's broken, the nerve is affected, the roots that are covering the nerve, which is a vessel, an artery, and a vein, that's what is a vascular system, it's so inflamed that it's pulsating and it feels so hot that when it's at the hot temperature, the tooth start getting more inflammation. And guess what? Sometimes I give you one tip. If you drink a glass of water, cold water, the pain can go away. But in the moment, you don't find the dentist to ask. That's one of the tips I give you. The other is take ibuprofen and Tylenol, which is 600 milligrams, 400 milligrams, or acetaminophen, Tylenol. That combination of the two pills at the same time works better than morphine, and it's not a narcotic. That is the best solution for this type of pain. But how do I diagnose myself? How do I know I'm gonna need a root canal if I am having this pain that it cannot get away and I need to know? So start by thinking, what is the history of my pain? Do I have pain a week ago, a month ago? How often is the pain? Is the pain when I touch my tooth? Is the pain when I bite? Is the pain when I put my teeth together? Is the pain even when I look at the tooth? Or the pain feels that everything is hot and it goes up to the upper level, to the lower level, to the front, to the back? It's a non-stop pain, and that is an irreversible inflammation of our nerve. That was an old classification. In today's day, we just want to know, do you need a root canal or not? Is the tooth alive or is dead? How infected it is? But mostly the protocol to clean this type of situations is the same in endodontics. But what do? We do percussion. So percussion means you go one tooth by tooth. If you have pain in this area, don't do only one tooth. If you think this is the tooth, still go to all the teeth one by one and do tap, 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 tap. And one you're gonna say, oh my God, that's a possibility, that could be the tooth. But if you're a grinding patient, that you're grinding your teeth, you're not wearing a night guard, then what is gonna happen? You maybe have a crack in the tooth, and that line of a crack has let bacteria to get in. And now guess what? It's very red, it's very inflamed, and it's trying to get out somewhere. And it cannot go out this way because it's closed. So you continue, it's gonna give the information to the whole trigeminal nerve. The pain is very confusing. Okay, so your first exam has to be in a whole area where you have the pain, even if it's this tooth, even if it's this teeth, because from this teeth in the front, the pain can be referred to the lower. And from these teeth can be referred to the ear, to the back, to the neck. So now, the first exam is remembering the history of your pain. The second exam is the cold. The cold test is gonna be right here in every tooth. Grab a piece of ice from your refrigerator, very tiny, and then start with one tooth by one tooth. Place the ice. You should feel the cold right away. It doesn't have to be pain. Then you go to the other tooth, then you go to the other tooth. Eventually, you're gonna find out that one, let's say, is not answering. That could be the possibility that is the tooth, and that for sure is a root canal. If on top of it you do this on the same tooth, and that's the worst, you said, okay, this is tooth number one, this is number two, oh my God, you're confirming again, this is the problematic tooth. But then now, when you go with a cold, maybe this one hurts a little bit, it's gone, doesn't stay there for a long time, but in this one, the pain is relieved when we place the ice. That is a root canal. So even if the pain is relieved, you have to try to find out a dentist, and in the meantime, stay with ibuprofen and Tylenol. And the other exam is palpation, bite test, so you go biting in every one of the teeth, and using all the area, you're gonna find what is the tooth problem. So if you touch all the teeth, one is gonna feel different. That is where you find the problem. Now you know you have seriously the need of call an emergency endodontics, but in the meantime, I'm giving you a great tip: take ibuprofen and Tylenol until you can reach your dentist. If you have any questions about this topic, you can always send me a message in our YouTube channel. Thank you.